I wanted to take a moment today to just reflect in the midst of medical grand rounds, which we consider to be a special tradition in the Department of Medicine. It really gives us an opportunity to come together weekly as a community. We share ideas, we learn, we discuss, we argue, we debate with each other. But it's a very important event in an academic community and in an academic department of medicine. But before we launch today in talking about science and clinical medicine, I thought it was important that we pause and really think about what's been going on these past 8 days in our country. And I personally, as a physician, as one of the leaders of this department, really felt it important that we take this moment and pause and think. As many of you know, I'm a cardiologist, and so this might have special meaning when I say this. My heart hurts this week. And the reactions to the brutal murder of George Floyd are the expressions of people across the country who've been pushed past the breaking point. And it's been horrific to watch. It's been sad. But I think it's been important for us to really take pause and to think about why this is happening. In the midst of all of this, we're in an infectious disease pandemic. And the COVID-19 pandemic has certainly laid bare the health inequities that we have in our society. There's never been a time that the social determinants of health have been exposed so clearly, so rawly. People in vulnerable communities are dying from a disease because of their race and because they're poor. That should not be acceptable in the richest country on earth. I've asked, and I've been asked a lot, including by people that you see every week on this screen, what can we do as a Department of Medicine at Stanford University? I honestly don't know the answer yet, but I can promise you this. We can't go back to business as usual. That's not appropriate. It won't be who we are. Some of you also know that I'm the product of a Jesuit education. Coincidentally, I attended the same college, the College of the Holy Cross, as Tony Fauci, exactly 20 years later. The motto of a Jesuit education is men and women for others. And that's what we need to be as a community at the Department of Medicine. We need to be men and women for others. I've recommended to many of my colleagues on the leadership team that they read a book called Fraternity by Diane Brady. It's the story of 1968 when then theology professor, Father John Brooks at the College of the Holy Cross, following the death of Martin Luther King, decided that he needed to do something. And what it is it's a powerful story of a single person changing the direction of a university, of a college forever. He personally recruited that year 20 Black men, mostly from the inner cities of the Northeast, to come to Holy Cross. He then mentored them, guided them, not just during their 4 years, but throughout their lives. Among those 20 men were a future Supreme Court Justice, a future Solicitor General of the United States, a future Pulitzer Prize winner. It's an extraordinary tribute to the bond amongst these men. And it's an extraordinary lesson that one person indeed can make a difference. And I'd ask us to think about that. So before we launch Grand Rounds, I want to promise and commit that Kathy Garzio, and I think Kathy's with us today, and I will be following up with our faculty, our staff, our trainees in discussions and meetings and listening tours. And we're going to report back to the community, not just what we've heard, but what are we doing? What are we implementing? What's important to us? So in that spirit, what I'd like to ask Errol, if we could have people shut off their video and just for 30 seconds or so, let's pause. Pray if you like, reflect if that's what you'd like to do, but really let's think about what's gone on in the country. Let's remember the brutality and the passing and the murder of George Floyd. And let's pray for a better place.